Hello, I'm Eric. I'm. What's your name?
Tyler.
Nice to meet you.
Nice to meet you. Thank you.
Do you know what you're here for today?
Just a general checkup,
Alright.
health exam.
Yeah, well, I'm gonna do a comprehensive health history with you today. It may take a little bit of time, but we'll get through it.
All right.
So I have some basic questions to begin with.
All right.
What's your name? Well, Tyler.
Mhm.
I assume that's spelled Tyler.
Yep.
And what was your last name?
Wardell. Wardle.
Right. Your cell phone number?
586-770-1266.
Your address?
21610 Van K Drive.
Is that K-A-Y?
Nope, just the letter K.
Alright.
Van, just the letter
Van
K,
K.
and then Drive. And that's in Grosse Pointe Woods, Michigan.
Alright, and what's your birthday?
10/24/92.
And do you know when or where you were born?
Clinton Township.
Township. And you were 26 then?
Yep.
Do you identify as male or female, or
Male.
are you married, or
I am single.
and what do you currently do for
A job?
job?
I'm an ER technician down at Henry Ford.
All right. What would you consider your race or ethnicity to be?
White or Caucasian.
And you said Henry Ford is your employer?
Mhm.
That's Henry Ford Health Systems.
Henry Ford. Yeah, Henry Ford Health System.
All right. So, do you have any current health issues that stand out to you, or?
No, the only thing I can think of, my blood pressure goes up a little bit sometimes. Other than that, no, nothing that I know of.
All right. Is that just in general high blood pressure, or does it spike?
Yeah, I mean, I'm sure there's certain things that make it go up every once in a while. It goes up earlier today, but
So
sometimes, I mean, there's a lot of times when I take it and it's normal. Sometimes when I'm even at work in a stressful environment,
Right.
you would think it's high, but it's not. We'll take it there and it'll be just fine. So I really don't know why it goes up sometimes, but
it hasn't caused you any issues?
nope,
Just
nothing.
did you have any illnesses as a child, or any prior?
I had chicken pox when I was younger. When I was really young, I had asthma, but I grew out of that. Nothing really. I've never had an asthma attack or anything like that. It was just I was probably falsely diagnosed, but I don't know. I get every once in a while I'll get like an eczema flare up, but it's very rare that it happens nowadays. It was more so when I was really young.
Right. Have you ever had any accidents, injuries? Have you broken any bones or anything like
I have
that?
never broken a bone.
Sprained anything?
I have partially torn ligaments in my left knee when I was younger playing putt-putt golf. I tripped.
Okay.
I tore all four of my ligaments. Partially tore all four ligaments in my knee. But didn't require surgery or anything like that, so.
All right. Do you recall the age that or just or general?
Second grade.
Second grade.
I don't know how old people are in second grade. 10.
Right. but second grade.
Second grade, yes,
that fits.
that year,
We can
that age range.
we can gauge that then. So you don't have any serious or chronic illnesses that you've
Nope.
stated. Have you been hospitalized for anything?
Nope.
Not as a child or anything, other than obviously when you were born. Maybe when you were born, I guess I shouldn't assume.
No, not that I can think of.
And so I assume no surgeries then?
Never had a surgery. I mean, I have my wisdom teeth pulled out. I think, that's technically a surgery, I guess.
Right.
But
Yeah, that counts. It's good
Sure.
to know for sure.
Mhm.
And I assume you have not ever been pregnant.
Nope. Never been pregnant.
How are your immunizations or
I'm up to date.
up to date?
Did all the immunizations as a child, so
You still getting flu shots regularly?
getting flu shots regularly.
Have you had the tetanus shot recently?
I imagine so. I get it. Whatever
Or
is
I shouldn't
recommended
say
by
recently,
whatever is recommended by my primary care doctor. I get it. So up to date.
All right. Do you know when your last physical examination was?
Actually just a few weeks ago. I went through. I'm attempting to commission in the Navy to help them pay for this actually, and so I had to go through a whole physical exam process with a Navy doctor and everything. So that was only 2 weeks ago. So I am good on that aspect.
What are you commissioning the Navy for? That's
Nurse.
just
Yep, I'll be a
Okay.
nurse. I'll be a nurse for the Navy.
nice.
Um,
That'll be really cool.
yeah, that's the plan.
It's
I
a
actually
really
just
noble thing to do.
I submitted my packet today.
Wow.
So I'll hear back. They said by October, maybe a little late October, early November is when I will hear anything.
Wow.
It's very competitive, so I'm not expecting to get it, but
Well, if you
we'll hope for the
keep
best.
at it,
Yeah.
and
Mhm.
just be determined, and
Yeah.
eventually you'll get
Yeah.
it. Do you have any allergies? Have you had any
Cats. I'm
allergies?
allergic to cats. I'm allergic to some type of dogs. I think it depends on like the oil in their fur or something. And I get like hay fever sometimes. Fall
So-
and spring. I just take like a Claritin every day. But no, nothing
Are those
else. Yeah.
severe or
No, not at all.
uh,
I just kind of maybe get like itchy, watery eyes. Sometimes, more so when I was younger, I would get a little bit like shortness of breath, but nothing serious at all. I've never had like a life-threatening reaction or anything like that. I don't have any known food allergies or anything like that. So,
all right. You ever have runny nose or
yeah,
swelling of any
yeah. Like
sort?
I'll get runny nose if from hay fever, like pollen in the air or something like that.
Mhm.
But I usually just take like a Claritin or something every day if it's been bothering me, and I usually don't have any symptoms.
All right. Do you currently take any medications? Any
Yeah,
over the top
like Claritin.
or prescription?
I'll take the Claritin sometimes. I'll probably start taking it more because it's getting into fall.
So you take it as needed.
Yep.
Yep.
Other than that, like the occasional Tylenol or something for a headache, but other than that, no.
All right, so now I'm going to ask you a little bit about your family.
Mhm.
How is your mother and your father?
There are a few medical problems on both sides. My mom has type 2 diabetes. She has had we think she has degenerative disc disease in her the discs in her back, like the vertebral discs.
Mm-hmm.
So she's had a lot of back problems. She's probably going to have to have surgery soon here, probably in the next year or two. She's already had a replaced left knee, full knee replacement. And she doesn't have osteoporosis or anything like that. She gets some arthritis. But other than that, everything else is pretty much good. High blood pressure with her. Like I said, the type 2 diabetes. But it's all controlled. All those are controlled with medication.
So she's in good health.
I wouldn't say that. But I mean, yes, she is.
And controlled,
yep.
I guess is a good word that you use.
Both of her parents, so the grandparents on my mom's side are both dead or deceased. My mom's mom, so my grandma on my mom's side, she died of... What did she die of? Technically, I think knowing what I know now, I think she died of sepsis, some sort of infection.
Because she had a...
Yep, she had a... perforated appendix or something that I think released, there's a lot of nasty that got released into her abdominal cavity or something, and an infection from that, I imagine. I don't really know. I should probably learn that now, because knowing what I know. But so she unfortunately passed. This was right before I was born.
Okay.
So they had been passed for quite some time now.
Do you know what year that was? That was
91, 92. I was born in 92, so I think they died, oddly, like within the year I was born. I think. And then my mom's dad, he died right after I was born, I think. Okay. It was either one or the other. But he died of cancer. I want to say lung cancer. I think it was lung cancer he passed from. Those are the only issues that I know of from them.
Right.
My mom does have an uncle or brother, so my uncle. There's nothing wrong with him. He's in perfect health. So that's it for my mom's side. My dad's side. My dad is in perfect health. He's fine. There's no issues that I know of with him. My dad's parents, so my grandparents on my dad's side, they both have type 2 diabetes. Both have high blood pressure. And they both have both knees replaced.
Both of them.
Yep, both of them. Yep, they both have both knees replaced. We are actually just, maybe over this past summer, we started to notice with my grandpa.
So they're both alive?
They are still both alive, yep. My grandpa is starting to shake and have, issues with kind of doing fine motor things. We have really no idea what it is. I don't know if he's seen a neurologist for it, if it's any sort of, early onset dementia or early onset, Parkinson's or anything like that. We don't know. And he probably won't go see a doctor until it's unfortunately a little late for it. But yes, we are starting to know. And it's not, it's not it's just a little, just kind of.
Noticeable.
Yeah. Other than that, they are okay. Then
Do you have any brothers or sisters?
I do. Yes. Yes.
I don't mean to interrupt.
Oh no, it's fine.
Your uncles or aunts on your father's side.
On my dad's side, yes, I have 2 aunts, and to my knowledge, they are all perfectly fine. There are no known issues that I know of with them. And then I do have a sister, older sister. Um, she has a lot of mental health history, like depression, and bipolar disorder. Um, she sees a psychiatrist. Her conditions are, at least to us, controlled.
Mm-hmm.
But there are times when are better and times when they're worse.
Right.
Other than that, she really doesn't have any issues either. No high blood pressure, or at least that I know of. Nothing no diabetes or anything like that. So, other than that, we are a-okay.
All right. Well, then we will move on to. We'll just go a little more in depth about your health.
Okay.
So there's going to be quite a few questions that we'll probe with, but
okay,
we'll get through them.
All right.
We might. We'll get through them. So we might retread some waters. For instance, I'm gonna start. I know you said you felt you're pretty healthy overall, other than blood pressure, high blood pressure.
Yeah.
So I'm just gonna ask some more questions regarding your general present state. Was your weight? Do you feel comfortable with your weight?
Yeah. I'm
Any fluctuation or?
No. It's pretty consistent. It's actually pretty hard to lose.
Yeah.
No. I'm actually just at so I'm 196 pounds, and for being 70, I'm 6 foot.
Mm-hmm.
That's apparently like just under the standard for my height. So I'm okay. I'm in a good range, yes, I imagine.
Mm-hmm. And so you have a diet. You're eating enough. You're not eating too much.
Yeah, I eat. I have a pretty good diet, or an okay diet. I wish I could afford nicer food, but it's expensive. I like seafood, but it's expensive.
Yeah.
But I eat. I get a wide range of things. I'm partially. I know I don't look it, but I'm partially Italian. I eat a lot of pasta.
Yeah.
A lot.
It's always good.
Yeah. There's a lot of pizza in my life. No, I go out often, eat out. I probably shouldn't eat out as much, but I do.
Right. You don't have any. Do you feel tired or weak? Any fatigue?
Feel tired from studying all the time. No, just kidding.
But no, nothing.
No, no, I don't have any fatigue. I sleep pretty well. I probably sleep too much, but I don't have any trouble sleeping or
you get enough
tired or weakness. All right, nothing like that.
Get enough hours of sleep over generally.
Surprisingly.
And do you sweat at night? Any excessive sweat when you're sleeping?
No.
All right. And then we'll talk about your skin. Do you have any obvious issues with rashes, wounds?
Nope.
Any discolorations?
Nope.
And you said you don't sweat too much, or
I think I sweat regularly.
No excessive bruising or any tenderness?
Nope.
All right. Hair? Any issues with hair?
Nope. I still have it.
Any changes in texture or changes in any patches or?
No.
All right. And your nails? Nails are good shape. Do you have any issues with them? Any lost nails or hangnails?
I get hangnails sometimes, but no, there's nothing wrong with my nails, at least that I know of.
No pain with them?
No pain. No. They grow regularly. I have to cut them every once in a while.
All right. Do you have any headaches or Any dizziness?
No.
And you don't have vertigo, I would assume, if you're not having dizziness.
No. No. I was gonna say like maybe like if I get up too fast, but I think
Right.
that's
Nothing
pretty
out
normal.
of the ordinary. As long as that's, I mean, you would take that as ordinary. Just
Yeah, I mean,
okay.
I don't have any issues like walking around because I'm dizzy all the time
Right.
or
You're
anything
not
like that.
fainting.
No.
Okay. I see you're wearing glasses.
Yes, do you like them?
A lot. They're good. So are the glasses okay? Do they?
Yeah, it's actually a brand new prescription, so it's actually pretty nice.
Everything's
I'm nearsighted, so I can't see far away. Yep, I wear glasses, I wear contacts, both equally. I'd say I probably wear my contacts more than my glasses. Yeah,
just out of preference, or
I think that they're just easier. I like to wear sunglasses outside, and I can't wear sunglasses outside if I'm wearing regular glasses.
you don't want to
So
put the two layers.
Exactly. So I usually wear my contacts so I can wear sunglasses. As funny as that is.
The contacts don't bother you, or
No, throughout if I wear them all day, they'll get dry and they'll kind of irritate me a little bit toward the end of the day. But no issues with those.
When you take them out, do you have any lasting irritation, or?
No, it actually feels good to take them out. I've been wearing them all day. It's like they feel dry. Like if I like moisturize them with like saline, sometimes it'll help a little bit. I can leave them in a little longer.
Yeah.
But no, if I've been wearing them all day, I usually take them out. And at night, I would prefer to wear my glasses because I feel like I can see better. I know it's gonna sound weird, but I feel like I can see better with glasses at night than with contacts.
In the dark, or just in general at night?
In darkness, yeah.
Okay. Huh.
Like driving at night, I would much rather wear my glasses than, like, I don't know what it is, but I feel like I can see better with them.
Okay.
Maybe, I think maybe my lenses on my glasses maybe that's like anti-glare. I don't know if they are. Maybe it's something like that. I feel like common. I can feel like, I don't know, I feel like I see better with them.
All right. And so it sounds like your eyes are right. You don't have any pain? Or...
Nope. When I went to that military doctor, they did a whole eye exam. I don't have any eye pain. I don't have any eye tenderness. They said I don't have any signs of glaucoma. My optic disc is an appropriate diameter. So no early signs of that. My eyes are okay, thankfully. And I get a new prescription every year, but
right. All right. And how are your ears? Do you notice any? Well, I guess you probably would notice an infection, but have you had recent infections or
no
discharge or excessive earwax?
No.
No. Itchiness, or can you hear okay?
I can hear okay.
You can hear me all right?
Yes. Yep. I was just also tested. My ears and my hearing were tested. I can hear tones. I can hear different, pitch. Good. Well.
No ringing or.
No. And that's good because I've been in bands and in high school and college and elementary school and such. So I play drums. I've been around loud music,
right,
or loud sounds my entire life. And thankfully I don't have any ringing or anything like that.
No difficulty hearing. I know I asked that, but nothing's muffled or
nope.
No hearing loss or signs of hearing loss.
Mm-mm.
All right. How are your nose, your sinuses? You said you have some allergies.
No problems with my nose or smelling. Um, I excuse me. I'll get maybe some runny nose or something with that hay fever that I talked about,
Right.
but nothing excessive. Excuse me. If I take the Claritin or whatever, any problem that I would be having would go away. So, but no nothing that sticks out. So
And no nosebleeds or anything like that.
no.
All right. Do you breathe okay through your nose?
Yeah.
At night, do you have any difficulty breathing through your nose, or
No.
all good? All appropriate. How would you say your sense of smell is
Good.
adequate?
Adequate.
Adequate.
Yes.
All right. All right. So we'll talk about your mouth and throat a little bit.
Okay.
Do you have any pain or any noticeable difficulty swallowing or aching?
No.
Your gums are all right? You
Yep.
brush your teeth and everything?
I do. Twice a day.
Okay.
I don't floss as much as I should, but I don't think any American does.
I would agree. We should always seek to floss as much at adequate amounts. Have you had any? You've had your wisdom teeth pulled.
Yes. All 4 wisdom teeth pulled at the same time.
And no, other than that, no tooth aches, no need for any other teeth removed.
Nope, no teeth removals. I have a few fillings, some cavities, and I've had a root canal.
Right.
No problems with those, thankfully.
They're all right. Nothing.
They're all okay.
You said you brush your teeth. You're
Mhm.
flossing every now and then.
Mhm.
Do you get dental checkups every now?
Yeah, every 6 months or whatever
6 months,
to go see the dentist. I think I'm actually supposed to go here in the next few weeks.
Right. Do your allergies affect your mouth or throat much?
No.
No. All right. And do you have any pain in your neck? You can move it perfectly well. Good range of motion.
Yep. No issues.
Nothing. No tender spots or anything. Do you? I know you're a male, but do you have any lumps or pains in your chest or
No.
any axillary pains or swelling, tenderness?
Nope.
All right. So we'll talk a little bit about your respiratory system, which is lungs, your breathing.
Okay.
When I guess I'll start. You did say you were diagnosed with asthma when
Yeah,
when
very
you were
young.
very young, but you don't have anything. anymore.
Never had. I mean, I really never had trouble breathing. I honestly don't know why I was diagnosed with it. I've never had an asthma attack. I don't even today. I don't have any issues breathing. I'm a runner. I've ran marathons. I don't have issues. No issues with breathing.
So no chest pains or
No.
no wheezing. Even when you're running marathons, you don't have any issues.
Nope.
All right. And do you think your heart is okay? Any chest pains?
No. I don't have any chest pain. Even like when running or like working out or anything like that. Never had any chest pain. I don't have any heart conditions that I know of. Um, I've never, I've never went to a doctor because I felt something wrong was with my heart. I've never.
Um, and your circulation is, how would you say that's all right as well? Do you get cold fingers, cold hands, cold feet?
No. I mean, my hands get cold sometimes, but it's.
Right, but
I don't
nothing
think it's. I don't think it's
out
abnormal.
of the-
I don't think it's abnormal.
Okay. And so you're not coughing, or are you coughing? Do you
No.
cough?
No. If I have a cold, maybe I'll cough here and there, but no, I don't.
Nothing chronic.
No.
Okay. Um, do you have any swelling and any swelling of the ankles or?
No.
Do you ever feel cold? I asked you that actually. Any tingling or numbness?
Mm-mm.
Um, do you have any discoloration of hands or feet? They generally.
No, nothing that I've ever noticed.
All right. And do you have any issues when you're at work? You probably have to stand and run around quite a bit. Do you
I
have
do.
any trouble with pain or swelling with your ankles or?
No, for as much as I have to walk around, no, I've never had any issues with my ankles or feet or any issues walking or pain or really anything like that, thankfully. Not even like I mean, my back might get sore from like working all day or, helping lift patients or moving people all day. But nothing like where it's debilitating or nothing where it, will interfere with my
What you're doing.
work or anything like that. So,
Do you ever have pain when you're not at work or when you haven't been recently?
nothing that sticks out.
Lifting or something?
No.
All right. So you said you eat well. You're getting enough food.
Mm-hmm.
You don't have any. You said you don't have any issues swallowing. Do
Nope.
you have any burning or any acid reflux when you do eat?
No. For as much pizza as I eat, no.
And do you any stomach noises that you think might be out of the ordinary, or
No.
no pain, any bloating or swelling when you eat?
No.
Do you get nauseous or have any bouts of nausea or vomiting?
No.
And it's not something everyone wants to talk about, but is your stool all right? I should
Pretty
say
normal.
all right.
I would say it's adequate.
You're not going too much or too little. Don't have any issues with. Or
No.
do you have any issues?
I don't think I have any issues. I probably go once or twice a day. I don't notice any difficulties or anything like that with going, so I'd say it's pretty.
No diarrhea or discoloration. It's
Not recently, not like
not black.
bad, and had any sicknesses recently where I've been having a lot of diarrhea. I don't have chronic diarrhea or anything like that, so.
Right. And you said you don't use laxatives or antacids. Do you
No.
just use
No.
allergy medications
Yeah.
here and there?
I mean, if I ever had an issue like, oh my gosh, my stomach hurts, maybe maybe I might take a Tums or something, but it's not something that I take daily or anything like that. So.
Right. So no chronic stomach pain or anything like that.
No.
All right. Now, how often do you pee? Do you have any issues with urinating?
No. I pee just fine. I drink a lot of water. I try to drink a lot of water through the day. My water bottle over there, I'll probably fill up maybe
Yeah.
5 or 6 times a day. Hopefully, I try to drink a lot of water, so I forcibly make myself drink water sometimes. So I do pee a lot. I have to pee right now. I pee just fine. I don't have any pain or discoloration. It's clear. It's going so. Yeah.
The flow is fine, or
Regular.
all right. When you do go, do you have any pain? Pain in your side or in your groin, abdomen?
No.
No burning. All right. Do you have any general pain in your groin, or have you noticed any lumps or anything in your genitals? No, it's not something everyone wants to talk about, but
I understand, but no, I don't. I haven't noticed anything out of the ordinary or any pain or lumps or anything like that. And when I was just at the military doctor, they checked
Okay.
for hernia and stuff like that, and I did not have any evidence of that.
we'll talk a little bit about your sexual health.
Okay,
Are you presently in a relationship?
I am not.
So, so no intercourse, or do you?
I would not. No, I'm not sexually active right now.
Okay. So are you aware of any diseases or?
No. I I had to give blood samples at the military doctor, and I didn't have any evidence of any HIV or any blood diseases or STIs, STDs. I've never had any. I've never had any STIs. I have been screened before,
Okay.
and there's never been any incidents of an STI or STD.
All right. So we'll move on to your muscles, your skeletal system.
Sure.
I guess we can actually start with your back, since you did say you had a little bit of pain.
Okay.
Sounds like it's nothing out of the ordinary, but do your back muscles feel like they're aching, or
No.
no pain?
Yeah. No pain. I mean, no like aching. Like my back hurts all the time, or nothing like chronic. No. I don't have any issues lifting. I don't have any issues like mobility issues or anything like that. I can move just fine.
Mm-hmm.
I'm able to exercise just fine. Yeah.
So I guess in more general terms, do you feel any stiffness or fatigue?
No fatigue.
You get
No stiffness. I mean, no like actual like oh my gosh, I feel stiff. But I mean, sometimes in the morning if I work out a lot
Right.
the day before, or if I do a really long endurance run
Mhm.
to like train for a marathon or something, I might feel stiff when I first wake up, just because I've been sitting for so long.
Yeah, that makes sense.
So once I get moving a little bit, I'll feel better. If I like stretch, I'll just stretch and I'll be just fine.
Right. You get plenty of. It sounds like you get plenty of exercise. So
Yeah.
All right. Do you get cramps or anything when you're exercising, or especially running? I'm sure you.
Every once in a while I will. It's maybe just from not waiting long enough for my food to digest. Funny as it is, but yeah, sometimes like maybe if I didn't stretch enough or something, it's really not that often. But I mean, there is an occasional cramp. Maybe I'm dehydrated or something like that. But it's not very often that I'll actually get like an actual cramp that like won't go away.
Right.
But it has happened.
Do you have any twitching or
No.
no
My
muscle
eye will
spasms?
twitch sometimes. My eyes will twitch, like, just sometimes, but nothing like, nothing that happens often or anything
Right.
like that. No muscle spasms. I've had a muscle spasm before, and it was terrible.
Was it during exercising?
It was not. It was a long time, maybe like 2013 or 14. I was volunteering at a summer camp for kids with cancer, and it was raining a lot, and we were like in the mess hall, like the cafeteria, and it was pouring. So we all like ran back to our cabins, and every night, well, not every night, but mostly every night, I would lead like almost like a little yoga session with the kids, to just like stretch out before you go to bed, even in the morning, stretch out in the morning. And that just one of those nights, I had an unbelievable muscle spasm in my back.
During the yoga?
Yeah, and it was terrible. I slept on the floor because I couldn't move.
Jeez.
Thankfully, because it's a like a medical camp for kids, so like even kids that are currently undergoing treatment, they can go and receive like the medications and whatnot while they're there at camp.
Oh,
So there's physicians, there's nurses, and everyone there. There's a little medical center that people that they can use and utilize for treatment or anything like that while the kids are at camp. But anyway, one of the doctors and the nurses had to actually give me muscle relaxer because the spasm was so bad.
jeez.
But it was fine. The next day, I was
No, yeah.
fine. And no, like long-standing issues with that or anything. It was just like a isolated kind of, oh my gosh,
Yeah, and
type
so
of
you,
thing. Like,
you didn't have any, no continuing.
no,
issues.
it happened once in my life, and
Okay.
that was the only time.
All right. So you said you run, so you you get, I'm sure, plenty of running.
Yeah, yeah.
Do you have any issues with mobility or
No,
any issues with daily activities that you might be doing?
No.
All right. Do you have a history of seizures? Or, well, you probably would have mentioned it.
Yeah.
But
nope. Never had a seizure yet.
seizures. No. You said no faintings or blackouts. Other than the what you'd consider ordinary head rushes. You
Sure.
stand up.
Right. In the middle of the night, and I get up too fast.
Yeah.
Like, oh, okay. Just take a second, and I'll be fine.
Right.
Yeah, but other than that, no.
Do you have any? Do you have any? No tremors or
no?
You're not paralyzed anywhere.
No.
I assume. I shouldn't assume that, but and then would you say you're cognitively? How would you say? Would you say
I
your
don't have any
memory is
cognitive
good, you're
deficits.
able to focus?
I am able to focus. I think I can give attention to certain things and concentrate appropriately.
You're able to study already.
Sure.
Or
Yeah, I've made it this far.
focus on your studies.
Yes.
Any mood changes or anxieties, or
No.
I know you said your sister had a history of depression. Do you?
Yes, she does. I don't have any history of mental illness. Never been to a psychiatrist or anything like that. I don't feel like I have any of those sort of issues.
Yeah.
No, I think I'm
You'd consider
doing okay.
yourself well,
I am happy.
and no hallucinations. I would assume you would have mentioned that.
Yeah.
Do you have any? You said your skin is fine, no excessive bruising or nosebleeds.
No.
Do you ever have lymph node swelling in the face or
No.
armpit?
No.
And I know you working at Henry Ford.
Mhm.
I'm sure you're exposed to a lot of
Yes.
potentially harmful things, but
Yeah.
you haven't come into contact with or any contact that you would need to report.
Like tuberculosis. Is that what you mean?
Yeah. Actually.
Yes, I have been. I mean, my TB tests have all been negative, so I've never needed a chest X-ray or anything like that. But yes, I have been, face to face with someone who has tuberculosis or meningitis, and maybe a half hour later, the doctor will say, "Oh, by the way, this patient's on precaution for. Can you put this patient on precaution for TB?" Like, oh, yes, I can put them on precaution for that, even though I've already been touching them and in and around their body for the past 20 minutes.
Would have been nice to know beforehand.
So yes, I mean, and I have been very in close quarters with those types of people, but I thankfully have never tested positive for it.
No pokes with sharps or anything like that.
No, thankfully I have not.
And you said so. Some of your grandparents have diabetes.
Mm-hmm.
You have not been diagnosed with that?
No. My blood, I've tested it randomly, sometimes at work, and it's always been within a normal range. My primary care doctor, because of my family history of diabetes, they have taken blood tests, thyroid tests, different, blood counts and such to make sure that, I'm not having any, factors that might be, leading toward those. Yeah, or anything like that. And then, just recently with the military doctor, they took my blood and everything, and they didn't. The results of that didn't indicate any disease or disorder. So.
All right. So no, have you had any issues with hormones? No need for hormone therapy, or have you had need for hormone therapy? I should say. You said you haven't noticed any changes in skin pigmentation or excessive sweating.
Nope.
All right. Well, we're over the worst part.
All right.
The rest is a little bit easier to get through.
Sure.
So just a few more minutes yet.
Mm-hmm.
So I'll just ask you a few more general questions now.
Sure.
Just lifestyle and life related.
Okay.
So your education, what was the last grade? Are you currently in education?
Sure. Yeah. So I have 2 bachelor's degrees, and I'm currently doing one right now here in Oakland.
What are the 2 degrees?
One is in psychology and one is in biomedical science.
Oh.
It's a lot of debt.
We're all in it.
Yeah. Welcome to America.
Yeah. I guess you said you've got debt. The next question is actually regarding financial
debt?
status.
Oh, perfect.
So you've got debt, but are you doing
student debt?
Otherwise,
so apparently it's the good kind of debt. But yes, I actually have started, even though it's very small payments. I actually have started paying them off.
And so you're able to. Do you have any financial troubles? Not trying to pry.
No. I mean, right now, because of this accelerated program, I am not full time. I'm what's called contingent, so I'm only scheduled for 24 hours a month. I can pick up more if I want to, but it is a little difficult not having a full-time paycheck.
Right.
So I basically make enough money to pay my car and pay that student loan payment.
So you're not having any financial turmoil. You would say
No, not yet.
you're doing all right.
I have not declared bankruptcy or anything like that yet.
Do you have any religious beliefs? Any?
I mean, I was raised Catholic, but I don't practice. I don't
practicing.
really go to church every week.
Would you say you have any, I guess, personal strengths and in relation to your values, would you say you've got a sense of what you value, a sense of ethics and
A moral
principles?
aptitude.
Yeah.
Yes, I think I'm a good person. I think I have, a values-driven life.
And do you take care of yourself? That's a weird way to phrase it, but
yeah.
would you say you take time to provide self-care for yourself?
Yeah, I guess working out or exercising, I think, is a good way for me to, relieve stress, I guess. Running, I really just like to run. That's a good way to, me time.
Mm-hmm. But you don't feel like you're overly stressed, or you don't have any
No, I don't think
issues
any
with
more than, the other college students. I think that my stresses are appropriate for my lifestyle. It's not like I'm so stressed out I can't, function, or I can't, complete things for school or for work. And I'm able to manage my life and manage my time, and I think that's a good skill to have.
And I guess to continue with exercise and working out,
Mm-hmm.
I won't have you explain your whole regimen and all that, but you work out frequently, it
Yeah.
sounds like.
I'd say I'd probably, maybe run 2 or 3 times a week, 1 or 2 times a week, and maybe go to like the gym and like lift weights maybe once or twice a week. I would like to do more than that, but with school, obviously can't.
School and work, it's
Yeah.
And you said you don't have any issue with daily life tasks, like
No.
brushing your teeth or mobility, getting dressed.
Nope.
Yeah, so we'll get a little more information on your diet.
Oh.
Do you know what you've eaten in the past 24 hours?
Chinese food.
Chinese food.
Asian food. Sweet and sour chicken. And cheesecake. That was yesterday.
And would you say, typical days, are you're getting a nice balance of...
Yeah, I'd say I'm not really a big breakfast person, but I'll usually have a lunch and a dinner, and maybe something in between, or something after dinner.
And do you prepare your own food, or
Yeah.
do you
I'll make it.
meal prep
Whoever.
or anything like
I
that?
do meal prep sometimes.
And so you said your finances are obviously, like all of us, you've got your student debt and everything,
Yes,
but
yes.
you have adequate money for food.
Yeah.
You're not starving or anything.
No.
When you do eat, I guess we'll say during dinner, is it
Mhm.
usually alone? Is it with roommates, with family?
All of the above.
All of the above.
It just depends on the day.
Do you? And it sounds like you don't overeat or stress eat,
No.
anything like that.
I mean, I'm sure there's times where, definition, I probably am, but no, I don't think I purposely, force food down my mouth if I'm not hungry or anything like that.
Right. So describe your role in your own family. Would you say, very briefly, not
Son, and,
That works.
I'd say educator. There's, I'm the only one in my family who's doing medical something. So naturally, everybody has questions pertaining to medical things now.
Right.
So I have to tell people things like, oh, well, what do you think this means? I'm like, okay, well, one, I hope you understand I am not a doctor.
Yeah.
But this is what it could be, blah, 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 blah.
Mhm.
Dr. Google says this.
You're kind of a teacher for your
Sure.
family.
Yeah.
And do you get along with family?
Mhm.
Well, no. Obviously, we all have arguments here and there, but you
Sure.
don't have any.
No,
Or do you have-
domestic violence.
Right.
No, nothing like that. No.
And your social life is okay. You get along with coworkers and friends, classmates.
Yeah.
Do you, if you were having a really big emotional issue, do you have people to go to
Oh, sure.
for support?
Yeah, family and friends.
Do you spend a lot of time alone during the day?
Studying.
Studying?
Yeah.
You said running and...
Yeah, I study all day. I mean, sometimes I'd say half and half. I'm capable of studying with people in the room, like watching TV or whatever. I prefer to study alone. Even depends on what I'm studying for, but I'm really not much even like a group studier. It depends what though. But that's
Right.
just me. I would rather study alone. That's just how I do it. I'd say, half the day is spent alone because of other, my roommates who I live with right now. They work. They
Right.
work through the day. So during the day, I'll be alone. And then when they come home, I'll be with people the rest of the evening.
Do you enjoy your time alone, or
I do.
Do you dislike it? Or...
No, it's okay.
I guess, would you consider yourself extrovert or introvert?
I think I am very much extroverted.
But you do also enjoy your
My me time?
alone. Yeah.
Yes, I do.
And so you said you talked a little bit about your stress. I mean, obviously, school. Do you get a lot of stress from work, or do you carry a lot of the stress from work
No, and
with you?
no. At least I don't think I do. That's one really big thing I liked about nursing versus if I were to have gone to medical school or something like that. Nurses, I believe that, when you leave work, you leave work.
Yeah.
It's very much separate.
Right.
I'm not the one to constantly talk about work things. I actually make an effort not to talk about work things with non-work people.
Mm-hmm.
If I'm out with coworkers, then yeah, of course we'll probably talk about work things.
Right.
But even then, if we're going out as friends and coworkers, I'm going to try to get to know you as a person outside of work, So like even then, like I'll try not to talk about work. Like I actually try to leave work at work. But I mean,
Right.
obviously, it comes up here and there, and I'm not gonna. Oh, don't talk about work.
Yeah.
Um,
So
yeah, like I mean, of course, there's harder days than others. Like if we were to deal with a lot of really intense things in the ER, which I mean, every day is intense. But I mean,
yeah, I
like
can imagine.
maybe a nurse got assaulted or something like that,
Right.
which happens, unfortunately. Or like a kid died or something like that. Yeah, those days are hard.
Mhm.
And it's just difficult sometimes, like coming out of an environment that really people don't understand if they're not medical
Right.
or if they're not, in health related things. People don't really understand. So it's hard to, if you relate
to them.
exactly. So yeah, it is a little stressful sometimes, but nothing like that's, gonna put me over the edge or anything like that.
Yeah. So you cope. You would say you cope well with the stresses and with
Yeah.
school and all that at work.
Mm-hmm.
All right. I just have a few questions about um, personal habits regarding drug use and all that.
Sure.
I guess I'll just run through a little list.
Yep,
Do you
lay it on
smoke
me.
at all?
Zero smoking.
So no smoking. Any vaping? I guess some
Nope.
people
Not even that.
consider it different. Do you drink?
I do. Okay, socially drinking. I'll drink, a beer or a glass of wine with dinner, or sometimes we'll go out with friends. I'll have, maybe one or two. And I wouldn't say, any more than that. I don't like binge drink or anything like that. So
Do you remember the last time you've had
yesterday,
alcohol?
when was it yesterday? 2 days ago. I was at a wedding in New York this past weekend. So we had,
It's an appropriate time to drink, I
Yeah.
would say.
yeah. I think that I had a few drinks there.
You weren't, were you, you can still remember things.
Everything about it.
All right. Do you use marijuana?
No, I don't use any drugs.
No. Okay, so I'm just gonna. Any painkillers? Some people don't consider those drugs.
No, I mean, well, like, over-the-counter
Okay.
drugs for, like, the occasional headache or the occasional whatever,
Right.
I'll take a Tylenol or something. But I've only ever used other, painkillers or opiates
Mhm.
as prescribed. Like, when I had my wisdom teeth out,
Right.
took it as prescribed, and other than that, really,
But you didn't, you weren't.
abusing them.
Right. No addictions.
No.
Okay. So I guess we'll talk a little bit about your home and your work.
Sure.
In terms of the environment.
Mhm.
Do you live in an apartment or a house?
Right now, me and two friends are renting a house. So it's a 3-bedroom, house.
Right. And would you consider it safe? Do you ever feel in danger there? Or,
No.
the facility's all right? It's temperature is you can
Everything
control
is-
the temperature while the water is running.
Yes. Yes, it is. The water is running.
Do you drive yourself or do you have any other
Car, you mean?
transportation?
Oh, yeah. I drive myself everywhere. We don't believe in Michigan. We don't believe in public transportation.
Buses and all that.
No, it doesn't exist.
You mentioned that you, I guess years ago you worked in a summer camp for
Mhm.
kids with cancer.
Mhm.
Do you still do community services?
Yeah. So that years ago is when I had that muscle spasm, but I've actually been doing it since 2011.
Okay.
This year, 2019, was actually the first summer that I haven't done anything with the summer camps.
Mhm.
I used to do a lot of different volunteering in college, but really not so much anymore, just because of work. And
Right.
well, this now, but
When you do drive, do you use your seatbelt?
of course, I always wear my seatbelt, and I don't speed, and I always use my turning signal.
Perfect. Do you do a lot of traveling? I know you said you went to New York.
Yeah, I mean, every once in a while, it's difficult being in school because you can't always afford it. But yeah, I'll go to the occasional wedding or the occasional up north trip or something with friends and whatever.
Do you go out of the country, or have you been?
I have been out of the country. I haven't gone recently though.
Where did you go?
I've been to Italy twice. I have been to Slovenia and Croatia.
And so you said you mentioned the Navy.
Mhm.
Did you do military service?
No, I have never served in the military. But we'll see. We'll see in November if I get in or not. Then after this
After you
program,
graduate,
yeah, I'll go somewhere.
That'd be really cool. Did you work as like with medics, or I guess nurses above medic? I'm not.
So from what I understand so far, medics like corpsmen, as they're
Mhm.
called in the Navy, will work under me. So they're essentially like in the civilian world, they'll be like the techs and
Techs
the nurse
aides.
assistants and the aides, and I think but with them being medics, I think they might function at a little higher of a scope than just a nurse assistant would.
Right.
At least my understanding. And I've been told that nurses are kind of like the managers for them, as they are in the civilian world too, usually.
Yeah.
Yeah. At least from
Very
what I know
cool.
so far, yeah. Mm-hmm.
This might be a little bit. If you don't want to talk about it, you don't have to.
Sure.
And also a very abrupt transition. Have you ever had any a history of abuse, of physical or emotional abuse with partners or anyone close to you?
No, thankfully.
And so you we'll talk. So you said you're an ER tech.
Mm-hmm. In Detroit.
And you said you do work with some hazards.
Yes, aggressive people. But no, hazards of health, like for meningitis or tuberculosis or blood-borne pathogens and such like that. But
no,
those are usually pretty controlled. At least we try to control them.
right.
Nothing that out of the ordinary of asbestos. Or, well, we never know. There could be some. I have no idea. But nothing like occupational health hazards or anything that violates OSHA or anything like that.
So the Henry Ford you would say they do an adequate or a good job at minimizing your exposure? Or...
Yeah, they try.
Would you say you have any health issues related to or would you health risks? Do you think you have any health risks related to
from
your
work?
Yeah.
No. Maybe high blood pressure, but other than that, no.
Right. And I'm just going to ask some questions about your own perspectives on health. And then I think that will finish this up. How would you define health?
Health? How do I define health?
Yeah. In just one or two words.
I guess the physiological and psychosocial well-being of an individual. That's context dependent.
All right. Do you have any health concerns?
I do not have any health concerns.
So you feel pretty good about your health then.
I am.
Do you feel like your health? Do you think your health is going to be all right in the future? Where do you see your health in 5 years? I guess.
Well, 5 years. I'll, of course, hopefully be done with school unless I do grad school. But I can just focus a lot more on me rather than focusing on extraneous variables
Yeah.
to help me.
Studying
Yeah.
all the time. And
So I think I will probably be, more likely be in better health.
do you have any health goals? Obviously, you work out and run quite a bit. Do you
Nothing in particular that I can, point out.
just to stay?
Stay where I am now. Lower my blood pressure a little bit.
Do you have any expectations of nurses or physicians
Work together.
that they work together?
Yes. Work together and just be nice.
And in relation to you, I know you're just here for a checkup, but would you say in relation to if you are being attended by a nurse or something, do you have any
Expectations?
expectations?
Just be nice. Be kind. Be informational. I expect you to be social and engaging. Have some humor. Don't be miserable all the time.
Right.
If be aware of the language you're using. If some people, obviously with me, if I go to a doctor or go to a nurse, I'm in the medical field. You're in the medical field,
Right.
so you can, what things are, and what they're supposed to mean. So, and I usually say I'm in the medical field or something like that, so they can talk to me straightforwardly, or they can be, very blunt about it. I would rather people be blunt and straightforward than try to filter information to me. But that's just me. Some people they don't like to hear the truth or anything like that. I am give it to me straight.
Right.
But yeah.
All right. Well, that wraps up this
That concludes our
health history
very good.
interview.
Very well.
It's been very pleasant.
Thank you so much. I
Great to
appreciate
meet
your
you.
time.
Yeah.